I'm Clarice Grody, and welcome to the Amplify OT podcast. I'm an occupational therapist by trade and a policy wonk by choice. This podcast is here to help you survive and thrive in the U.S. healthcare system through a better understanding of policy, advocacy, and value-based care. So, let's dive in. Hello everyone and Happy New Year. Welcome to 2022. So I am excited to dive right in today and discuss what new changes we will be experiencing in the new year. As you may remember, we had a lot of proposed and final rules come out this fall, and the majority of them are implemented on January 1st. CMS does tend to run on a calendar year, so many things for Medicare start over on January 1st of the new year. So we are now in 2022. And the first thing I want to update you all on was our last episode where we discussed the Medicare Sequester and the Medicare PayGo and pending cuts that were coming to therapy and across the board in Medicare. As expected, Congress did pass legislation to delay these cuts. As a reminder, the Medicare Sequester and the PayGo posed a potential 6% overall cut to Medicare spending, and Congress heard the advocacy efforts from our national associations as well as numerous healthcare organizations and delayed the PayGo until 2023. So that means that the 4% proposed reduction for the PayGo will not take effect until 2023. So they will have to pass legislation again to delay that further. They have staggered the Medicare Sequester to be implemented throughout 2022. So what that means is that the Medicare Sequester will not be implemented right away. So what they've done is, in order for it to be implemented throughout the year, there will be no change due to the Medicare Sequester from January 1st through March 31st. But starting April 1st, there will be a 1% reduction, and that'll go through June 31st. And then starting on July 1st, there will be a full 2% reduction. So we do expect another call to action later in the year, so keep an eye out for that, and hopefully there will be further legislation passed to further delay those sequester cuts. And last but certainly not least, we'll discuss the Medicare Physician Fee Schedule cuts. So these cuts impact anything that is determined by the Medicare Physician Fee Schedule, and that is predominantly going to impact Medicare Part B or outpatient services. You may remember in 2020, we had a call to action to delay a 9% proposed cut through the Medicare Physician Fee Schedule to therapy services as well as others in order to increase reimbursement for physicians, specifically for primary care physicians. Now, at the end of 2020, Congress passed legislation to temporarily increase spending on Medicare Physician Fee Schedule by 3.75%, therefore mitigating the 9% cuts. Now, that 3.75% temporary expansion was going to run out at the end of 2021. So, what Congress had to do in this case is they passed, as part of that same bill that delayed the sequester and the PayGo, they passed a temporary Medicare Physician Fee Schedule increase of 3%. So instead of a 3.75% cut from the Medicare Physician Fee Schedule, we will now be dealing with a 0.75% reduction. So if you're trying to keep up with the math, that means that January 1st of 2022, we have a 0.75% reduction in reimbursement for anything that is determined by the Medicare Physician Fee Schedule, and the sequester will not have any reductions until April 1st, which will be a 1% and then a 2% reduction July 1st, assuming that Congress does not take further action to delay those cuts. So before we review the OTA Modifier reductions, let's switch gears to home health. Home health has a big change coming for the home health value-based purchasing model. So this model has been going on in 9 different states for the last few years, and CMS has decided that it is now the time to expand this model nationwide. Over the last few years, the home health value-based purchasing model resulted in over $100 million in average yearly savings, as well as an improvement in overall quality outcomes for home health agencies. So if you're not familiar with these value-based purchasing models, it's a way to incentivize improved outcomes as well as spending through payment adjustments. So if you have high quality outcomes, your pay can overall be increased, versus if you have low quality outcomes, you can be penalized in reimbursement. As part of this program, CMS released their quality measures supporting interoperability and transfer of data between post-acute care settings. Now, those requirements are not part of the 2022 calendar year. They will be required in 2023, but agencies are allowed to start reporting that data, and it's definitely encouraged that you do report that data to start practicing before it becomes a requirement. So in their final rule, Medicare announced that they will expand the home health value-based purchasing program to all 50 states, territories, and the District of Columbia beginning January 1st of 2022, and it'll be a pre-implementation year, and then in 2023, everything will be finalized for the first performance year, but payment year will not start until 2025. So you have now 3 years to get adjusted before the payments start taking effect, but obviously you don't want to wait until, December of 2024 to start looking at how this is going to impact your facility. The other big obvious update for home health is something we've been talking about for a long time, but is the permanent flexibility of occupational therapists to be able to initiate the Oasis in therapy-only cases. So under the public health emergency, you may be aware that occupational therapists can initiate the start of care Oasis in all cases, so those that include nursing as well. But once the public health emergency expires, then this permanent rule will take effect, so occupational therapists will be able to initiate the Oasis in therapy-only cases. A therapy-only case means that a skilled nurse or skilled nursing was not included on the initial home health evaluation. So under normal circumstances, if a skilled nurse is included on the initial home health orders, then the nurse must initiate the Oasis. But otherwise, it used to only be PT and speech therapy who could initiate the Oasis on therapy-only cases. But after over 30 years of advocacy, this flexibility is now permanent. So it has been a huge win for occupational therapy. It's a really great opportunity for occupational therapists and occupational therapy to demonstrate their value in home health. Now, under Medicare law, it is still required that the most appropriate clinician initiates the Oasis, and it's important for occupational therapists to advocate and educate their agencies about their ability and this permanent flexibility. So the last but certainly not least biggest change that therapy will face in 2022, or that we are currently facing, is the occupational therapy assistant and the physical therapy assistant payment adjustment. So this was passed as part of the 2018 Balanced Budget Act, and if you go back, I have a previous episode all about the OTA modifier and how to utilize it, but this is a 15% cut off the Medicare reimbursement, so 15% of the 80% that Medicare pays for Part B services. So this applies to all Part B services for therapy that are provided by an OTA or a PTA unless you work for a CORF, which is a comprehensive outpatient rehabilitation facility. So this still applies to Medicare Part B observation patients in acute care hospitals. It still applies to hospital outpatient centers unless you are part of a CORF. Other than these primary updates, there's a couple other coding changes that were released that I've got in my article about the 2022 Medicare regulation changes. There's also some debates about the telehealth legislation and those sorts of things. So make sure that you're still engaging in advocacy. We do not yet have permanent flexibility for OTs, PTs, and speech therapists to be able to provide telehealth to Medicare patients. So once the public health emergency ends, then the ability to provide telehealth will go away. So make sure you're taking action on those pieces of legislation. Otherwise, I hope you all had a fabulous and a healthy new year and a healthy 2022. In regards to news for this podcast, my plan is to start releasing these podcasts on the first and third Thursday of the month, so make sure you subscribe, and I'll see you next time. Thank you so much for listening to this episode of the Amplify OT podcast. If you have a question you want me to answer, or you just want to say hello, send me a voice memo and you might be featured on my next episode. And as always, don't forget to subscribe to the Amplify OT podcast wherever you listen to your favorite shows. That way you never miss an episode. And my last ask is that if you like the show, please consider leaving us a 5-star review, as it helps other people find this podcast, or just share it with a friend. So thanks again for listening, and I'll talk to you next time.